From the time we first learn to roll as infants, there's a possibility of bumping our heads and experiencing a minor to major head injury. And as we grow older and become more active, this likelihood increases vastly, especially if involved in sports or other intense activities. So it's important to learn what really happens when you encounter a strike to the head, as well as the safety precautions that can be taken to increase the chance of avoiding any major damage. The term head injury is a very broad term that describes a vast array of head traumas. These can widely range in severity from a minor bump on the skull to a severe blow to the head that could cause major brain damage due to hemorrhaging, and can be broken down into a few categories, including concussions, contusions, and skull fractures. While concussions are the most commonly spoken of form of head injury, most people don't understand exactly what the term is referring to.
Not every head injury leads to a concussion. Concussion is a clinical diagnosis where you are looking at a patient and looking at how they're feeling and what symptoms they're having, and that's how you make the decision. There's no blood test you can do, there's no x-rays you can do to diagnose a concussion.
Your brain is a soft organ which is defended by spinal fluid that normally prevents it from hitting your tough protective skull. And when your head or body is hit with an excessive amount of force, the brain can push through this fluid and crash into the skull, causing it to become injured. You don't necessarily need to be hit directly in the head for a concussion to occur. Your body being stopped abruptly can also produce the same symptoms. So how do you know when you should see the doctor?
So loss of consciousness is a big one because that's indicative of a pretty significant brain injury. That doesn't necessarily mean you're going to have long-term problems, but other more subtle changes are inability to walk or talk, or any neurological dysfunction, if your arms or legs aren't working right, if you have persistent nausea or vomiting, blurred vision, changes in your mental status, just a lot of confusion, asking questions repetitively, not remembering certain things. They say people have amnesia with a concussion of both the event itself, and you can also have some amnesia from the period right before the head injury and the period right after.
While any blow to the head or body has the potential outcome of a concussion, some of the most common causes are from intense sports, bicycling, automobile accidents, including those involving motorcycle riders wearing helmets, and assaults. It's important in any of these cases to realize your symptoms and seek medical help if needed. Contusions can happen pretty much anywhere on the body, yet it can become a far superior problem if it occurs on the head or skull.
Contusion is essentially a bruise or some damage to tissue that causes a little bit of swelling. And so most of the time when we get bruises on our arms and our legs, we will have, a little bit of soreness, maybe a little bit of swelling there. But for the most part, those are handled very easily and very well, and they're not that dramatic. On the skull, you don't have much tissue underneath that. Really, you have skin, you have some layers of tissue, and then just skull. And so when you have that swelling and that bleeding, it tends to come out a little bit more, what people call a goose egg. Having a goose egg doesn't mean you have a concussion, but it sometimes is more dramatic.
Contusions on the head or skull can be caused from the same or similar instances as concussions. And while it may not mean that you have a concussion, you should take the same precautions by contacting your physician if you experience comparable symptoms. Skull fractures are considered the most serious of head injuries. It can lead to severe damage to the brain and even be fatal.
Skull fractures mean that you had a tremendous amount of force applied to your head. It takes a lot of energy to break a skull. So when we see that, we become very concerned about problems with the brain, including intracranial hemorrhages. If there's any evidence of skull fracture out in the field or out at a site where someone's had an injury, immediately you need to contact medical personnel, call an ambulance, call 911, and have them transported to the nearest hospital, because skull fracture can be a life-threatening problem.
Minor head injuries or concussions, in some cases, may be treated with supportive care and symptom monitoring. Skull fractures will more than likely result in the need for surgery or a consultation with a neurosurgeon at a minimum. This, of course, depends on what kind of damage has been done to the actual brain cavity. While there is no way to completely prevent head injuries from occurring for children or adults, there are some things we can do to help avoid serious trauma. Wearing helmets is obviously a proactive approach in any wheeled activity such as bicycling, dirt biking, snowmobiling, or motorcycling. Though major trauma causing a skull fracture will likely call for a surgical solution, time is the answer to most head injuries. Refrain from repeating an activity, especially intense sports such as football or hockey, where you put your head at risk of encountering an injury in the same location, causing further damage to the brain.
Your likelihood of the symptoms being much more intense goes up, and there's something called a second impact syndrome that has been identified in multiple cases. And they don't exactly know what happens, but there is severe swelling of the brain when you have 2 concussions or 2 traumatic brain injuries in a short period of time. This can be fatal, and this is one of the big reasons why we really hold people out of sports and out of athletics.
Speak with your physician if you're unsure whether or not you should be participating in any activity and how long you should be inactive after an incident. Injuries to the head may lead to brain damage and can even be fatal. So it's important that you take the serious precautions to reduce the risk of high-impact contact.